This video is going to be on non-neoplastic causes of an increased concentration of lymphocytes in blood, and I have those four main causes listed here. I'll go into further detail for the first three causes on the next slide, but I will just pause here to talk more about the young animal lymphocytosis or pseudolymphocytosis. And this really isn't a true lymphocytosis. This is just when you're using adult reference ranges or adult reference intervals on young animals. Young animals normally have a higher lymphocyte concentration than adults. So again, inappropriate use of reference intervals for the age of the animal. Physiologic lymphocytosis is due to epinephrine release, just like the physiologic neutrophilia. And with epinephrine release, there's an increased blood flow, and that results in washing of the marginal lymphocytes from their marginal pool into the circulating pool. So there's a shift from marginal to circulating, and again, those circulating lymphocytes are the ones that are sampled during a blood draw. Now, there's also other mechanisms that contribute to this physiologic lymphocytosis that you may read in your notes, but the shifting from the marginal pool to the circulating pool is what I want you to concentrate on for testing purposes. Now, along with the physiologic lymphocytosis, remember that it can also cause a neutrophilia, also because there's a shifting from the marginal pool to the circulating pool. And there's splenic contraction, and the spleen stores lots of red blood cells and platelets, so you can see increased concentrations of those cells in blood. And then epinephrine release can also cause a hyperglycemia or increased glucose concentration. Chronic inflammatory lymphocytosis is the lymphocytosis that occurs during antigenic stimulation. So there's some sort of inflammatory stimulus that has persisted over a long period of time, perhaps weeks or months, and this has caused the lymphocytes in the secondary lymphoid tissues to undergo proliferation, so undergo hyperplasia. And these lymphocytes don't just stay in the secondary lymphoid tissue, they make it out into circulation as well. So with chronic inflammatory lymphocytosis, it's due to hyperplasia, lymphoid hyperplasia. So support for this type of lymphocytosis, you might see a left shift, so you'll look for indicators of inflammation, including a left shift and toxicity. Usually there is also a neutrophilia, but the neutrophil count might also be normal. Hypoadrenocorticism is also known as Addison's disease, and it's a condition in which there's failure of the adrenal cortex to produce cortisol and aldosterone. And the mechanism for the lymphocytosis with Addison's disease is a deficiency of cortisol. So cortisol normally causes lympholysis, so lymphocyte death, and it also homes lymphocytes to lymph nodes. So they go to lymph nodes and they stay within the lymph nodes. So if you have a lack of cortisol, then there's less lymphocytes dying and there's less lymphocytes homing to lymph nodes. So you have a proliferation of lymphocytes, or not really a proliferation, just an expanded lifespan of lymphocytes. And you have less homing to lymph nodes, so they stay in circulation longer. There are lots of other chemistry and urinalysis findings that can support hypoadrenocorticism, and you'll learn more about those later. But at least on the CBC, if you see an eosinophilia or an increased eosinophil concentration, then that could also potentially support hypoadrenocorticism.